Sleep apnea is actually a breathing disorder that occurs when you're asleep. Generally, it's associated with snoring, and people's airway is blocked off or obstructive by some mechanism while they're asleep or trying to breathe while they're asleep.
There are two kinds of sleep apnea. The first, most common type is obstructive sleep apnea. That's where when you're relaxing and going to sleep, all the muscles in your airway will tend to become floppy and they may close off. There's another type of sleep apnea called central sleep apnea, and that's where your brain doesn't send a signal to take a breath.
Sleep apnea is mostly noticed by a spouse or a family member telling them how badly they snore, and also sore throat, dry mouth when you wake up in the morning, daytime fatigue.
Sleep apnea not only bothers a bed partner with snoring, but underlying sleep apnea, you have a higher risk of developing things like high blood pressure, increased risk for stroke, heart attack, heart rhythm disturbances, including atrial fibrillation, even other things like erectile dysfunction and depression. So by trying to treat the obstructive sleep apnea, we can try to avoid or manage some of these underlying other medical conditions that a person may have. There are many ways to try to treat sleep apnea. First and foremost, as we look to see, is there something that can be done about a person's weight? Because the heavier a person is, the more likely they may have some sleep apnea. So diet and exercise can be very helpful in managing sleep apnea. Sleep apnea is most commonly treated with a CPAP machine. And so CPAP means continuous positive airway pressure. So it's a device that actually is just an air compressor pump where there's a mask that is worn at night, and the air is circulated through that mask into the person so that it helps to keep their airway open and helps to prevent collapsing the airway so that they can get good at gas exchange and can breathe better at night. CPAP works about 95% of the time, so it's again one of the most beneficial ways we can treat sleep apnea.
One of the latest treatments for obstructive sleep apnea is called the hypoglossal nerve stimulator, and it's actually a surgical implant. So there is a cuff that we put over the hypoglossal nerve branches that go specifically to the tongue base, and then a little wire goes down to a generator which is placed in your chest over the pectoralis muscle, so that when you breathe, a little electrical pulse is sent to your tongue base to contract and get out of the way so that you can breathe while you're asleep.
You don't need a device in your mouth, you don't need to be attached to a hose or air pump to treat your sleep apnea. It's all done internally.
And you turn it on with a remote control. So it's a remote control, you click it on when you're ready to go to bed, and then you click it off when you get up in the morning and you're ready to start your new day.
A good candidate for this device would be someone who has difficulty using CPAP, who has tried and failed other methods of managing their sleep apnea, including weight loss, who have a relatively low body mass index, who has moderate to severe sleep apnea. Those would be the best candidates for this type of device. If someone is interested in this device to treat their sleep apnea, the best thing to do is to see a sleep specialist. They may need to have another sleep study to determine how much sleep apnea they have, what the severity is, and if there are other confounding variables that may be a problem with treatment. If they are good candidates, then we refer them on to Dr. Puig for further assessment.
So a patient who comes to me for a consult for the hypoglossal nerve stimulator, and they meet all the criteria ahead of time, they're generally sent by their sleep medicine specialist. We weigh them at the time of the office visit to make sure they're in the right weight range. And then we talk about a drug-induced sleep endoscopy. While they're asleep, snoring on the operating table, we put the scope in their nose and we record what their palate does, what the sides of their throat, their tonsils do, the tongue base, the epiglottis, the vocal cords. So we're recording the snoring and how the airway collapses. And if we clearly see anterior to posterior collapse, that tongue base is falling back, it's getting in the way, the patient can't breathe, they are perfect candidates for this procedure. So the surgical procedure is done in the operating room with the patient asleep under a general anesthesia. The incision is about 2 inches long under the angle of the jaw, right about right here. We use a microscope to magnify the nerve and we dissect out the specific branches that go to the tongue base. And then once we identify those, we put a very small little cuff around those branches only. And then after that, we thread a little wire down under the skin over the collarbone to the chest. And with the chest incision, this is where the generator is placed. And then we secure everything in place, and then we plug it all in, and then we test it. So the anesthesia machine is breathing for the patient. We turn the implant on and make sure that it's doing what we want it to do, which is picking up the breathing, sending the electrical impulse to the tongue, and we could actually see it working. The recovery after the implant is placed is basically 3 days of rest and hanging out at home. The other thing that's important to know is the patient is not using it right away. They need a month of healing.
This device is the only FDA-approved device that works inside the body, so you don't have any attachments to any device outside of your body. And this is covered under most major medical insurances at this time.
The benefit is a good night's sleep.
Treating sleep apnea is very important. It's going to help a person's quality of life. It's going to help prevent major medical problems that can arise in association with sleep apnea, like high blood pressure, like increased risk for stroke, increased risk for heart attack, diabetes.
A good night's sleep without having a CPAP or a hose or something coming off of you or getting askew every time you roll over or change position. And with a good night's sleep, you get your life back.